Hi, this is Garrett Gunderson. This is another installment of the Productivity Tips, and I've got Dr. Brady Frank with me. I met him at an event with another dental influencer, and she's like, I've got someone you got to meet. Immediately, I was attracted to his passion and his excitement around what he was doing and kind of his story. And then after meeting him, he just kept creating value on a regular basis. So I said, hey, I want to get you out here to do a productivity tip because this particular influencer that's been on another productivity tip increased 70,000 of revenue by bringing in Brady and learning what he's going to talk about here today. So I'm not a dentist, so I don't know all the details. That's why I'm going to interview you. And thanks for being on this.
Hey, I'm glad to be here.
So just, before we jump into it too far, tell us a little bit about your background and your story and things that way.
Yeah, well, about 13 years ago when I was a junior in dental school, I realized I had to buy a practice when I got out of school. So I interviewed a bunch of dentists, ended up buying a practice right out of school, bought another one 5 months later, and ended up buying like 12 practices in the first 5 years. Found out during that phase that I just really loved dental implants. And ended up selling most of my practices and started really just focusing on implants. And I'd been trained by...
Now, do a lot of dentists think implants are tough or they're scared or shy away from it?
They do, yeah, they do, because the training nowadays is done mainly by specialists using specialists' equipment, which is kind of surgically geared. And so what I've been doing over the years is kind of making the implant armamentarium something that is easy for the general dentist, using general dentist tools that they've got right there. So it's kind of demystified a lot of it and kind of changed the whole format for implants in the general practice.
I can't imagine there's a lot of people out there running around saying, man, I just am totally passionate about implants. I figured out, and it seems like anyone I talk to is a little nervous about it or a little bit scared of doing it.
Yep.
So you said you're making it more accessible to the general dentist.
Yep.
How does that work? How do you go about doing that? Start walking me through that.
So I found that a lot of the implant companies actually did their training where it was more surgically geared rather than minimally invasive, which everything's going minimally invasive. LASIK surgery, endoscopic surgery on our knees, and dentistry was just a little bit behind the times, I think. So I actually founded an implant company called OsteoCore, and I manufactured a line of implants that, there have been actually hundreds of thousands of them placed now, these particular models. But it's a line of implants that is a conventional implant, but you can actually do it with your general dentistry tools. Like the initial osteotomy and soft tissue entry is done with a high-speed handpiece. And so a typical, I call it old school implant, where you flap the tissue back, cover the implant, have them back for another surgery, uncover the implant, put a healing cap on, have them back for another appointment, is kind of slowly being phased out. And so what I call the new school implant dentistry generally only takes about 5 minutes from start to finish, including the impression for the final crown. So I call it the 5-minute implant, abutment, and crown.
So high margin, low period of time.
Yep.
As far as the amount of time the dentist has to spend.
Absolutely.
And how often is this someone coming in for a different, they're just coming in for an appointment, they're getting a checkup and they find out they need an implant, or, tell me how that works and what it does from a marketing standpoint, or just adding it to an existing business and how invasive that might be for the dental practice.
Well, that's a great question. In fact, when I attended one of your mastermind meetings in Salt Lake, you had mentioned that one of the ways to add massive equity to a business is add hot topics to it, or leverage hot topics.
Yeah.
And so what I found is the most talked about procedure in dentistry is the dental implant. People don't talk about their root canal or their filling they had, but they love to talk about their implant because it's kind of a newer thing in dentistry. Well, so I developed a few ways of marketing specifically for the implant patient. And so now, in addition to my normal general dentistry practice, I see about 100 implant consults per month, and do about 100 implants. Some patients might be 1 implant, some 7 implants. And so it's gotten to the point where, side by side, a crown prep or a filling, I can be, doing an implant or two, because it only takes 5 minutes, per implant with the impression now. So that's been a huge thing, and that's kind of the thing that most students that I see monthly have been really interested in.
So obviously you've dispelled some of the myths and misconceptions around it as far as people thinking, okay, this is multiple meetings and it's very technical and I got to go through surgical, invasive type things and I got to learn from a specialist. So you've streamlined that. modified it where it's a lot easier. What are some of the other obstacles or common questions that the doctor has? Because, you know, dentists typically are more methodical and detail-oriented, and they have some of those questions probably popping up. What are those commonly asked questions?
Yeah, so the most common question that's asked is, hey, what about post-operative discomfort, and how can you tell where the bone is underneath the gums if you're going to do it without flapping them? And so quite simply, I use a panoramic x-ray. After the patient's numb, there's a special tool that you probe the bone with. And then with your high-speed handpiece, I've got a special burr that's an implant burr for your high speed. And so you actually do your initial soft tissue pilot through the gums, through the keratinized tissue, and you do your first 6 to 8 millimeters of your osteotomy with the high speed. So if you're doing implants on tooth numbers 4 and 5, you know, osteotomy, 2 of them with the soft tissue. And the system that I developed, it's a 1 drill system. So after the pilot hole, you do 1 drill, and then you put in your implant. The implants that I put together are 3-in-1 implants, so they already have the abutment and the lab thing attached to the implant in the package, but they unscrew after you place the implant. So you place the implants, that's the first 2 minutes, and then you take an impression, that's the next 2 minutes, and then you unscrew the abutments, stick them in the impression, send it to the lab, put healing caps on, and then have them back in 30 to 60 days to put the final new teeth on. And so so that's a common question. The other common question is, you know, a lot of people talk about the no drill implants that I do.
You see why I asked what the common questions were, because I'm not a dentist.
Yeah,
I don't know how the hell to ask all that stuff, but you know, I'm sure the dentist that's all making perfect sense.
And people that are listening are probably like, how do you do the implant in 5 minutes with the impression?
Yep.
And how do you make it 2 appointments that's normally 5?
Yep.
And so the other common question
Are you charging more or less?
Yep. I actually charge less. What that's done is, by doing more implants, more people are talking about it. So 80% of my new patients come from people that have implants. So I found by charging less, the practice is actually generating more revenue. This last month, I just talked to my office manager, and it's me solo part-time. They're at like $235,000 of collections on lower fee implants. And I would say about maybe 50% of that volume's from implants. The other 50% is root canals, crowns, all the fun stuff. But the neatest procedure, and I'm doing an article in Dental Town on this next month, it's called the no drill implant procedure. The implants I developed are kind of like an osteotome, meaning they compress the bone. But basically, right after you extract a tooth, you immediately, within 20 seconds of extracting the tooth, screw the implant into the extraction site, and it converts the extraction site from an oval to a cone, basically. So the implant converts that extraction site into an osteotomy. So you immediately place it without a drill. And I've got a 23-second video on YouTube that, you know, for people that are interested can get it through you guys. But it shows me extracting a tooth, putting the implant in, and right now there's about a 97.5% success rate, you know, with the immediate no drill implants. And so people ask, well, you know, shouldn't you graft bone around that? You know, old school was put the implant in, graft a bunch of bone around the rest of that extraction site. And the answer is actually, when a tooth's taken out, the blood clot forms, that turns to collagen, and then that collagen turns to bone. So the implant's kind of in the middle of the socket, and some of the socket bone is not touching the implant. But basically, I use some people call it the Frank finger graft, but it's basically you cut a little piece of tissue where that extraction site was, wrap it around the implant healing cap, put 1 suture on the other side, and you've got a keratinized cuff of tissue around the implant, which covers the socket, and the socket immediately fills up with blood, which turns to collagen, which turns to bone. So I don't do really any bone grafting in my practice. I only do the 80% of the cases that are easy, you know, for the general dentist.
Refer the other 20% out.
Yep, refer, and then from that 80%, do the 80% that come in that are easy cases.
So how do you train other docs to do this?
Yeah, well, I do a 2-day mini residency every month, and I go over 12 modules, efficient implant placement for the GP. And so I actually place 30 implants. So we'll do a surgery, we'll go over a module. We'll do a surgery, do a module. And it's about 15 or 16 credit hours. And usually you leave there with all the surgical equipment that you need for your practice. And currently, right now, actually this year, 100% of the dentists that leave that are placing implants within 2 weeks. Last year was like 95% were able to place. So, I mean, it's pretty action-oriented. And a lot of the dentists that had gone to this seminar had been to, on average, 3 to 4 seminars where they didn't start placing implants.
Does it ever compete with other, like if a dentist introduces this, does it ever take away anything else in their practice, or is it pretty much they're able to still see the same volume they were able to see, still able to do all the other procedures they were able to do, and this is just added revenue, or does it in any way create any level of distraction or concern, or how have you addressed that?
That's a good question. The startup practice that I did about 18 months ago, I was doing a certain amount of general dentistry and implants. But with implants getting so efficient, basically the implants are put in the time slots that are just open or between patients. So if you're doing, say, $100,000 a month in your general practice and you decide to add efficient implants, not just regular implants, but efficient implants to your practice, you should be able to do that same $100,000 in general dentistry revenue. And then on average, the first year after the course, they add about 26% increase. So you might go to like 126,000.
And how much of that 26,000 is net?
So I have a buyer's club through my implant company, and so the implant's like $98, abutment's $40, and the crown is $98. So you're looking at about $250 for the variable expense on the overhead. All your other fixed and variable overhead should be pretty much covered. So on the extra $26,000, you should have a max overhead of about $6,000 on that. So it's about $20,000 net added on to the practice.
So other than whatever labor, but that labor is just time that was already kind of, you know, most docs want to be filling the white space and getting things done.
Exactly.
So anything else you think the docs should know about when it comes to this implant thing?
Yeah, you know, I would say for those listening that you know, want to not only do implants like you might now be doing, but want to, you know, get into a new paradigm, a new school implants, you know, just learning the 5 top flapless techniques for minimally invasive implant dentistry. We go over the punch-through technique, the direct technique, the high-speed technique, and a couple others. And, you know, so I've worked with a lot of dentists that, you know, come through all your stuff, and and thankfully, most of them are really on the ball financially, probably because of your courses. And so, because most of you watching this right now, you know, have already been through the Freedom Fast Track program, you know, what I'm offering is a sample implant, a free one for anyone listening. So if you email Garrett or email whoever, just call our office. Kelly runs that, and she'll take down your size, the size implant you want to use, and she'll send a free one out to you, because 96% of people that try one implant, you know, just switch over to use.
Yeah, and you'll see that right here on the screen. So just follow the prompt on the screen or enter and click on that. So it'll take you to whatever discount Brady's offering here. And I just want to take a moment here to talk about the impact equation, because here's the thing. If you want to earn more money, it's a byproduct of value creation. So in order to create more value, this impact equation, I'm going to split it into 2 things. Either one, you can impact people on a deeper value that are already coming through the door, which is exactly what you're talking about. Or you could see more people. Now, what's important is when you can add leverage to that. And so rather than having a 5-step process here, which is very specialized and very old school, you utilize the newest technology, you're able to learn quicker, you're able to get it done in a quicker and more efficient time. Therefore, you keep more dollars by adding more value in an efficient time period. So I just wanted to kind of take that and put it in fast track terminology for a little bit.
That was good, and that's you know, thinking about it, that's exactly what happens with it in the practice. And so.
Well, I'm glad that you're passionate about this whole thing, man. I mean, it's funny because, you know, it was talking about $70,000 impact in one trip that you made out. And I thought, well, that caught my attention, you know, and I talked to the doctor that you were working with on that. And you and I have gotten to know each other ever since that time, and had several conversations and talked to many people that have learned from you and implementing these types of things and referred some people to you. So thanks for making a contribution and, you know, offering a productivity tip, getting into some technical stuff. And I know a lot of docs like that. Some of that obviously over my head. I'm not trained in that, but you know, I've brought on like Dr. Stephanie Mohan and had her. I said, what are the cool gadgets out there for dentists? And she gets going on things that, you know, are a little bit different than what my understanding is. But that's why I like this productivity tip series, is to bring specialty and a new idea of what's out there and how docs can improve their bottom line without necessarily having to always just work hard or get concerned about, do we need to do more marketing? That's usually the first place they go, but they have this whole patient base that they might be able to serve in this gold mine that still is right there and existing for them. So any final thoughts?
I don't think so. I just say keep doing what you're doing, because the dentists that come through my courses, that have been through your courses, just say awesome things. So we've now just made it a given that we give out your initial book to folks, because adds huge value to whatever they're doing. So thanks for what you're doing. Keep on doing it.
All right, thanks, man.
Hey, thank you.